guys, now we want to start off with adrenergic drugs, correct? They are sympathomimetics. So they are going to, what and all they are going to do? You remember that, what and all they are going to do? In the case of emergency, fear, flight, fright, okay? The neurotransmitters are norepinephrine, epinephrine, and sometimes they are including dopamine here. The receptors alpha, beta. So what exactly happens here? Mydriasis, reduced saliva flow, increased heart rate, vasoconstriction, so increased blood pressure, reduced peristalsis, secretion, all digestion is off, all elimination off, okay? Then a lot of glucose so that the person can run away from the situation. All this you know from the previous video, correct? So I'll just a recap for you. So just look at exactly what happens, what receptors, where, what happens, okay? Obviously, mydriasis, reduced salivary secretion, bronchodilation, increased heart rate, CNS stimulation happens, then glycogen breakdown, so excess glucose will be there, less insulin so that they can have more glucose, digestion, elimination, everything off, bladder will relax, bladder can expand, vasoconstriction, blood pressure will increase, skeletal muscles will get good blood supply, lipolysis, ejaculation, uterus contraction if it is a non-pregnant uterus. All these are sympathetic, okay? Now let us look at the drugs which are important. So here you can see adrenergic drugs, sympathomimetics classification. You have pressor agents, cardiac stimulants, bronchodilators, nasal decongestants, CNS stimulants, anorectics, uterine relaxants. See, first of all, you try to understand. CNS stimulants you can understand. Definitely it will stimulate the CNS. It is a sympathetic drug. It's a sympathomimetic drug, adrenergic drug. So definitely it will stimulate CNS. Bronchodilator you can understand. You have to run away from the dog. You need oxygen. Bronchodilation. What about cardiac stimulant? Obviously the heart rate is going to go high, correct? And obviously the blood pressure will increase. Nasal decongestants, how does this work? Nasal decongestants. Because there is reduced secretions and also vasoconstriction. So both of these will help in nasal decongestion. Okay. What about this pressor agent? Obviously narrowing of blood vessels, vasoconstriction, so increased blood pressure. Noradrenaline, dopamine, okay, you should know, phenylephrine, all these you should know. Let us look at the important drugs and where they are used. First, let us look at the pressor agents here. Pressor agents, here you have dopamine. Dopamine can be given for treating Parkinsonism. It is actually given as levodopa. Cardiogenic shock, circulatory failure. Here, actually don't look at dopamine as Parkinsonism treatment. We will come to that in Parkinson chapter, anti-Parkinsonism chapter. As of now, you remember it is used to treat cardiogenic shock and circulatory failure. Actually, what happens if there is circulatory failure, instead of giving adrenaline or noradrenaline, actually instead of giving noradrenaline, they prefer dopamine. You know why? Because noradrenaline will work only on those alpha and beta receptors, but dopamine will work even on alpha, beta and also dopaminergic receptors like the D1, D2, it works on them also. So, in circulatory failure and cardiogenic shock, dopamine is preferred. Okay. Phenylephrine we have already seen in the last video for funduscopy along with tropicamide. You can use phenylephrine for mydriasis for funduscopy. Okay. Then moving on to cardiac stimulants, adrenaline. Adrenaline very important, you should know. In the case of anaphylactic shock, adrenaline is given. This is anaphylactic shock, adrenaline is given in this case. So this is like hypersensitivity. A person is suddenly going into this hypersensitive or anaphylactic shock. Then what will happen? If you give adrenaline, it will increase the blood pressure and also there is going to be bronchodilation. Okay. Adrenaline, how much it is given also you should know. It is 0.5 mg intramuscularly it is injected. Okay. It is a life-saving measure. It is this anaphylactic shock is an emergency. Adrenaline will save that person's life. And where does adrenaline come? In adrenergic drugs. Okay. It's a cardiac stimulant. Then adrenaline was also used in combination with local anesthetic, because when you give it in combination with local anesthetic, what happens? There will be vasoconstriction. So there is less bleeding, and also the local anesthetic will be in that local area only. You understood? So even this local anesthetic will not be able to enter much systemically. So the systemic toxicity of this local anesthetic also will be reduced. Three uses, you understood, right? One, less bleeding. First of all, vasoconstriction. Because of vasoconstriction, less bleeding. Secondly, the local anesthetic will stay in the local area which you want. And thirdly, the local anesthetic will not enter systemically much, and it will reduce the toxicity. Systemic toxicity will be reduced. Okay. Then what else you can give this adrenaline for? Obviously, you can use it to dilate bronchus in case of asthma, etc., etc. Okay. If there's hypoglycemia, they give adrenaline so that the person is can make more glucose. So we are done with cardiac stimulants. Let's move to bronchodilators. Bronchodilators like salbutamol, terbutaline. You should know these two names, salbutamol and terbutaline. I have actually seen salbutamol with theophylline combination. What does this theophylline do? This is actually a methyl xanthine. Okay, xanthine derivative. It is anyways not relevant here. It is also bronchodilator. Okay. Let us move on to the next group here. Nasal decongestants. Nasal decongestants, you should know all the names, guys. Phenylephrine mainly. Nasal decongestants, all the names, this whole box you should know. Xylometazoline, oxymetazoline, nafazoline, zolines. Then phenylephrine you also saw here for fundoscopy. Phenylephrine is also nasal decongestant. Then you have pseudoephedrine. Ephedrine actually is written here. It is a pseudoephedrine. By vasoconstriction reducing the secretions, it will become a nasal decongestant. Correct? Just look at this diagram here, this photo here. See this? Very over the counter people buy this kind of nasal sprays which is having phenylephrine. Okay. Even Cineris, the normal tablets that you buy, those also have phenylephrine. Okay. Now, so far where we are, nasal decongestants, you should know phenylephrine, pseudoephedrine, xylometazoline, oxymetazoline, nafazoline. You should know all these 5 names. Okay. Some other names are also there in the textbook. If you want, you can read them also. CNS stimulants, uterine relaxants. If you want, you can know the salbutamol or terbutaline also, uterine relaxants. Okay. Anorectics are there. Anyways, we are going through only so much now. So we have finished the uses of adrenergic drugs. The drugs and their uses we have finished. So what you will take back from this video, mainly the questions that come for the exam are dopamine, how dopamine is used in cardiogenic shock, circulatory failure, this is very important. Nasal decongestant, important for exam. Adrenaline, how it is used, and life-saving drug, how much you should give and all that. That's also important for exam. Okay. Salbutamol also important. They can ask this again in the respiratory system drugs. Okay. So that's all for now. We have finished adrenergic drugs. The last one we have to cover are anti-adrenergic or sympatholytic drugs. Meet in the next video for those. See you. Bye-bye, guys. Tata.